At one point this morning, a COVID patient who needed an ICU bed couldn't get one. No hospital in the state had a bed and a staff available to handle a virus case anywhere.
It has since opened up a little, but that was the dramatic upshot announced by Governor Asa Hutchinson this morning. The numbers released about an hour ago indicate 1,367 people hospitalized. Of those, as of 2 o'clock, 550 were in the ICU. Hospitals had about 18 critical beds available, but not the type that could handle designated COVID patients.
Other stats from today: 2,223 new cases is a slight increase from last week at this time. Active cases came down a little, but a sobering number in today's report: 45 deaths reported, 40 of them in the last 24 hours. And those numbers underline the news the governor delivered. The strain on our hospitals is growing even worse.
THV 11's Jordan Howington joins us now with the big takeaways from the governor's news conference.
The governor focused on several key issues the state is facing when it comes to the coronavirus pandemic. So let's take a look at the 3 important things you need to know that came from Tuesday's briefing. The first thing he focused on: COVID ICU beds are full across Arkansas. The governor did clarify that there are still ICU beds available for non-COVID patients, but according to the latest numbers, about 50% of ICU patients statewide are battling the virus. That's the highest we've ever seen. Right now, hospitals are working to open up more COVID beds, but a big challenge, getting more staff to make this happen.
Everybody should know that the strain this is on our hospitals and the need to get our vaccinations. And how critical our bed space is.
The second takeaway from today's news conference: the average age of hospitalized COVID patients is now lower compared to last year. In November 2020, the average age for COVID-19 hospitalizations was 63 years old, and now that average is 54, meaning more young people are ending up in the hospital.
With the Delta variant, we're seeing more serious consequences in the younger ages, groups like this.
The third thing state leaders emphasized today: the Department of Health has now announced an advisory on the medicine ivermectin. The drug is generally used for large animals, though can be used for humans if prescribed by a doctor. Health officials say some Arkansans have taken a veterinary grade of it, either to prevent or treat COVID-19. As a result, the Poison Control Center has seen an increase of calls. So the warning from ADH: don't take ivermectin. It can be toxic.
If you've taken this, you've had nausea, vomiting, neurologic symptoms, please call the Poison Control Center or your doctor for advice.
State leaders also talked today about COVID in schools. Cases have seen an increase with more than 4,000 since August 1st, but so far no schools have had to switch to full remote learning. Stay with us for the latest.
Thanks so much, Jordan. Governor Hutchinson also says at least 89% of all new COVID cases, hospitalizations, and deaths are among people who are unvaccinated.
And the number of so-called breakthrough cases among people currently infected has been stuck at around 15% for 3 weeks.